left-handed PSA. So I'm going to do the PSA closest to me, which will be the left PSA. Now, with the PSA, retraction is key. You really have to be good with your retraction in order to get that vestibule open so that you can really see where you're going, and you get your finger out of the way so you don't inadvertently contaminate your needle. So the key to the retraction is to just place the gauze in the corner of the patient's mouth. Make sure that your retraction finger, the glove, is nice and tight. Okay, so you really want to pull that retraction finger nice and tight. Now, what I'm going to do is I'm going to push my finger past the gauze, and I'm going to physically touch the maxillary tuberosity with the tip of my finger. Then I'm going to slide my finger between her teeth and the ramus, and I can feel that it's tight in there. Then I'm going to have her close halfway and shift your jaw towards me. That really opens up the vestibule nice and big, and I'm going to hook my finger forward. So the tip of my finger is now touching the zygomatic bone. You want to make sure that your finger is still touching the zygomatic bone, and you bring your thumb nice and high up on her cheekbone. So you're hooking your finger to really open that vestibule. Okay, that's the key to the retraction of the PSA. Now, we also want to see, as an instructor and the board examiners, is we still need to see part of the occlusal plane of the maxilla. If the patient closes too much, it's really hard for the examiners to see the occlusal plane and to see your angles, because we've got to get the barrel to the ala of the nose and the mid-sagittal plane. So you have to have a 45-degree from the mid-sagittal plane to the ala of the nose. It kind of makes like a pie shape is what we're looking for. Okay, so that's your retraction. Now I'm going to pick up my syringe, palm down, big window down. I'm gonna flip my hand over, and the reason we do that is because we want to check to make sure the harpoon is set. We want to make sure that the stopper is above the red line and you don't have a big bubble in your cartridge, okay? So get the syringe all set in your hand, make sure it feels good before you take that cap off. Then I'm just going to kind of wedge my cap off. You cannot pre-loosen the cap for boards. Okay, I'm going to pick, oh my God, it's already there. So now I'm going to push past. So I parked the syringe on my hip so that it's not in the sight of the patient, but yet I can see it in the periphery of my eye, so I know where that needle is at all times. I'm going to push my finger past the gauze. I'm going to touch the maxillary tuberosity. I'm going to slide my finger between the alveolar ridge and the ramus, asking my patient to close and shift towards me, which she has done. Then I'm going to, now don't leave your finger straight. You got to hook your finger to give yourself some room. And I've got a good grip on her cheek. You've got to have a good grip. You can't be timid with the PSA. Now, I'm going to clear the lip with the needle. You cannot touch that needle to anything. I'm going to clear the needle. I'm going to get it back almost to where I'm going to touch my penetration site, and I'm going to swing the needle to touch my finger. I'm tucking that needle underneath my finger so that now I am with the ala of the nose. So the barrel is directly with the ala of the nose. I'm going to touch the tissue and say I'm at my minimum penetration. The examiner will say, I see, proceed. I'm going to advance the needle halfway the length of the distance, and then I'm going to gently drop the barrel towards the patient's shoulder, and I'm going to advance to 4 millimeters showing from the hub to tissue. Now I'm at my maximum depth and angle, and you can see that the barrel and my finger are attached. They have not separated. You want to keep this retraction finger touching the barrel so that you can help guide that barrel downward and the needle upward. So I am now at my maximum depth and angle. The examiners will say, I see, proceed. I am going to aspirate by gently pulling back on the plunger, on the stopper. I have negative aspiration. Make sure you wait 3 seconds before you say negative aspiration. The examiners will say, I see, proceed, and then I will say depositing. At that point, I will deposit until the examiners tell me to stop. Okay, now I'm done with my injection. I'm going to lift up slightly, and I'm going to come out very gently, not touching anything on that needle. Okay, then I'm going to come over and I'm going to recap my syringe and put the barrel back down.